for taking the time to join today's NeedyMeds special topic webinar, the PAN Foundation, Connecting Underinsured Patients with the Treatment They Need. My name is Carla. I'm the Director of Education here at NeedyMeds. And before we get started, I'm going to go over just a few what I call housekeeping tips. You can feel free to ask any questions you have throughout the webinar by typing them into the questions section of your GoToWebinar control panel. I'm thrilled that we have such a robust audience today, but I do want to let you know if we don't get a chance to answer your particular question, we will certainly follow up with you personally via email within about a day of the webinar. Of course, we will also provide you with the contact phone number for both NeedyMeds and the PAN Foundation. If you are interested in receiving a copy of today's PowerPoint presentations, you can send me a message again in the questions section or shoot me an email again after the webinar. I also want to let you know that the webinar is being recorded and it will be available for viewing on the NeedyMeds YouTube page soon. What we do is we convert it into a video, and we'll usually get that up within a few days or at the latest by the beginning of next week. I also encourage you all to check out the NeedyMeds YouTube page. There's a lot of really great information available through our previously recorded webinars. So with that, let's get started. For those of you that are not familiar with NeedyMeds, we are a national nonprofit education, and that's our mission statement right there on this slide. We are dedicated to both educating and empowering those seeking affordable health care. And we really define education in two ways: by letting people know certainly about the resources NeedyMeds has to offer, but also by letting them know about other resources such as the Patient Access Network or PAN Foundation, where underinsured people with life-threatening chronic and rare diseases can get the medications and treatments they so desperately need. Today, Aisha Zam will be walking us through the presentation. Aisha is the Director of Provider Relations at the PAN Foundation. She manages PAN's medical provider and pharmacy outreach and ensures that PAN's providers and pharmacies receive high-quality customer service from their call center and claims administration partners. Aisha has a Bachelor's of Arts degree in Liberal Arts from the University of Missouri, Kansas City, and a Master of Science degree in Health Informatics Administration from the University of Maryland University College. So without further ado, I'm going to pass both the mic and the screen to Aisha, so please bear with us while I do that. You may hear just a couple of moments of silence. And in the meantime, you can just check out a snapshot of the NeedyMeds homepage. So let me go ahead and switch the screen. And Aisha, you should be able to take it away. Thanks everybody for your patience and enjoys today's presentation.
Hi, everyone, and thank you for joining us today to learn about the Patient Access Network Foundation. My name is Aisha Azam, and as Carla mentioned, I am the Director of Provider Relations here at PAN. Today, I'll walk you through what we do, why we do it, and how you can apply for and receive assistance. Access to medically necessary health care is critical for successful patient outcomes. Yet, access is often impeded or blocked entirely by cost sharing. Cost sharing refers to healthcare expenses that are not covered by an individual's insurance plan and must be paid out of pocket. These out-of-pocket expenses come from deductibles, co-payments, and coinsurance. People who have insurance yet are unable to afford the out-of-pocket costs not covered by the insurance company are deemed underinsured. Additionally, someone is considered underinsured if a person's medication expenses is more than 10% of their annual income. For people with a chronic or life-threatening illness, the cost of care can add up quickly. The underinsured population spans across Americans of all ages and income levels, affecting between 25 to 30 million people. In many cases, out-of-pocket costs reduce or prevent access to prescribed medication, and this negatively impacts both quality of life and the course of disease. Limited access to prescription medications exclude patients from the benefits of new drugs, specialty drugs, high-cost generic medications, and other medically necessary high-cost prescription medications. In many instances, even modest out-of-pocket costs associated with lower-cost drugs can prevent access to medically necessary treatment. These concerns are not leaving us. Advancements in therapy could mean even higher prescription costs. An increasing cost-sharing burden falls directly on patients, and increasing health insurance premiums mean that patients who are already having difficulty paying for their medications will need to pay more to simply maintain their health insurance coverage. It is unlikely we will see any major structural changes to our healthcare system in the short term, and so cost sharing remains a high priority and a high risk. The Patient Access Network Foundation believes that cost sharing should not prevent anyone from obtaining medically necessary treatment. Today, I am going to tell you how PAN can help the underinsured obtain access to their medications. The PAN Foundation is an independent national 501c3 organization dedicated to helping federally and commercially insured people living with life-threatening, chronic, and rare diseases with the out-of-pocket costs for their prescribed medications. We provide direct support to patients who need copay assistance, premium assistance, or travel assistance by providing them with financial assistance through a grant. Since its founding in 2004, PAN has provided more than 700,000 underinsured patients over $2.5 billion in financial assistance through more than 50 disease-specific programs. This slide shows the type of available programs we have spanning the chronic, oncology, and rare disease space. We encourage you to check out our website, panfoundation.org, for a full listing and more details about each disease state. So who qualifies for assistance? PAN has more than 50 different disease-specific programs. To qualify for assistance, patients must meet the following criteria to be eligible. 1, the patient must be getting treatment for the disease named in the program to which he or she is applying. So if the program is for asthma, the patient must be diagnosed with asthma in order to qualify. 2, the patient must have health insurance, and insurance must cover the qualifying medication for which they seek treatment. 3, the medication must directly treat the disease. 4, the patient's income must fall at or below 400 or 500% of the federal poverty guidelines, depending upon fund-specific guidelines. What this means is that each program will either be set to a threshold income of 400% of the FPL or 500%. And you can learn more about each one on our website to see which is for which criteria. And 5, lastly, the patient must reside and receive treatment in the United States. However, U.S. citizenship is not a requirement. Again, it's important to note that the insurance and income criteria vary for each program. To get started, you need a few pieces of information to apply. 1, patient demographics, such as the patient's name, address, phone number, and email address. 2, the patient's diagnosis and medication name. 3, the patient's health insurance information. 4, the patient's income and the number of people in their household. And lastly, the physician's contact information. Once you have all of this information ready, you're able to apply for assistance. There are 2 main ways that someone can apply. If you are a person looking for assistance for yourself, you can give us a call or apply online through our patient portal. Additionally, your caregiver or family member can also apply on your behalf. If you are a provider or a pharmacy, you may also reach out to us directly or use one of our online portals that are designed for pharmacies or providers to receive assistance. If you give us a call, we're available Monday through Friday from 9 a.m. to 5 p.m. Eastern Time. And then again, you can use the portals. So we have 3 portals, one for healthcare providers, one for pharmacies, and one for patients. Each portal is designed with the user group in mind. For example, the provider and pharmacy portals allow users to enroll and manage patients, check claim statuses, and run reports. On average, it takes about 7 minutes to complete an application, whether you do it online or if you give us a call. And you'll find out if the patient is approved for assistance immediately. We will provide you with the patient's enrollment information and then also follow up via a fax to providers and a letter in the mail to patients, so you have all of the relevant information you need. If you have any questions at all, please give us a call at 866-316-7263. In just a few minutes, you will be enrolled in the program and you can immediately begin submitting your claims to PAN. We want the process to receive reimbursement to remain simple and quick for you and your patients, so we provide several ways to pay claims. If you receive your medication from a pharmacy, your pharmacy can bill us directly. If you receive your medication from a doctor's office, then the doctor's office can send us the bill electronically or by fax after billing the insurance company. And if you prefer to pay out of pocket and get reimbursed directly, we'll make sure to communicate with you every step of the way until you receive payment. Assistance in all of PAN's programs lasts for 12 months. And for new patients to PAN, we also help to cover any claims that may have been incurred in the last 90 days. If your eligibility period ends and you still need assistance, we can re-enroll you for another year. We know that every situation is a little different, so if you have any questions throughout the process, or if you are unsure if we can help, please give us a call. We are standing by to answer your questions and ensure you can get the help you need. By removing patients' financial barriers, our hope is that patients and their caregivers and family members can focus on what's most important, their health. Managing an illness is difficult, and people who apply for assistance from PAN may need support beyond copay assistance. They may have questions about their disease, treatment, side effects, and medication adherence. And they may benefit from connecting with a compassionate community that can help them deal with the physical and emotional complexities of their disease. That's why we align with leading patient advocacy groups to provide patients with the holistic support they need. These groups will reach directly out to patients who are interested in learning more. On the screen, you'll see a snapshot of the different leading advocacy groups that PAN works with and refers patients to on a daily basis. Another great resource we have is our website. We have designed specific sections for providers, pharmacy, and most importantly, for patients. By navigating the top menu bar, you can access audience-specific tips and tools to find program information. For instance, if you were to click the Patient section, you will see a list of all assistance programs and their eligibility criteria. You will also see referral information to other organizations if we are unable to assist you. Under the Provider and Pharmacy sections, we have frequently asked questions about how to enroll patients in PAN and how to file a claim for reimbursement. We also have designed short webinars about our programs and tools to locate resources for your patients. Whether you're new to PAN or you've used us for several years, we guarantee that there will be some information available for you. Our goal is to help you find the support you need so you can spend less time on the paperwork and more time with your patients. The PAN Foundation is one of many resources to help you and your patients. We encourage you to reach out to us so we can listen to your needs and understand how we can help. We love hearing from our patients, providers, and pharmacies that we work with. If you have a story where you've used PAN in the past or you'd like to just learn more, please reach out to us by sending us an email at info@panfoundation.org. Additionally, if you have any questions and you'd like to contact me directly, whether you're a brand new organization to PAN and you'd like to have a webinar specific to your team, or if you just have a question on how to get started or continue assisting your patients, please reach out to us. My contact information is listed on the screen, and I look forward to working with you soon. Thanks so much for your time and all you do. At this time, I'll go ahead and turn it back to Carla.
Thank you so much. As always, we are thrilled to be able to have a representative from the PAN Foundation explain the resources that are available to patients that so desperately need them. Let me go ahead and grab the screen from you. Hopefully you can see my screen. Can you? Is that correct?
Yes, I can.
Fantastic. So thank you again for that very thorough and informative presentation. And I will encourage everybody, if you do have any questions, go ahead and send them to me in the questions section of your GoToWebinar control panel. And again, if we don't have the chance to answer your specific question, we will follow up with you via email probably by tomorrow at the latest. And of course, at the end of the webinar, I will leave you with both of our contact information to our organizations. I do see questions coming in, which is fantastic. Thank you, everybody. And I will take a moment to also mention that I went ahead and put copies of the PowerPoint presentations into your GoToWebinar control panel. If you have trouble accessing or downloading them, certainly shoot me a message in the question section or send me an email after the webinar. Before I pass the questions coming in over to our guest today, I want to take a moment to make sure that everybody listening is also aware that NeedyMeds is a source of information for people seeking affordable healthcare options for their particular expenses. And NeedyMeds, we are, as PAN, a nonprofit. All of our services are free and anonymous to access. And not only can we help you get, hopefully, assistance for your medications, but we can also try and connect you with programs that will provide you with support for additional healthcare expenses. What you're looking at on your screen right now are just examples of databases found on the NeedyMeds website that will help you find cost savings programs specific to your condition. The Prescription Assistance Programs database will help you access a program that will get you your name brand medication for free. Our Diagnosis-Based Assistance Program is a database of resources that will help you to get cost-saving solutions for things that fall outside of the realm of medication. For example, maybe you need help paying for testing supplies or assistive technology. You check under the Diagnosis-Based Assistance Programs database. We also have the $4 generic discount drug program, which is where you can get low-cost generic meds. We have a very robust clinics database, which contains about 14,500 clinics across our country. We have a very popular database of coupons and rebates. That's sort of a safety net if we couldn't provide you with a diagnosis-based assistance program or prescription assistance program to help your situation. We also have databases dedicated to people living with a specific diagnosis that can get access to camps, retreats, recreational programs, and educational scholarships. One of the things you don't see on that slide is the other way that we can help people save money, which is through the NeedyMeds drug discount card. If you're interested in learning more about NeedyMeds, please join us for one of our monthly webinars, which teaches you further about the resources we have to offer and also how to navigate our website. The next one is coming up on September 13th at 1 o'clock. Eastern Time. That's a Wednesday. And you can find all of these cost savings programs on the screen under the Patient Savings tab of the NeedyMeds website. And you can check out our webinar calendar on the bottom right-hand corner of our home page. So with that, I'm going to go ahead and start passing some questions coming in along to our guest. And while I do so, I'm going to go ahead and keep our contact information up there on the screen. So Aisha, one of the questions coming in is somebody wants to know whether or not the PAN Foundation, does PAN connect to the hub service vendors that pharmaceutical companies use? I'm not sure if I'm phrasing that the right way.
Sure, that's a great question. So while we do work in some capacity with manufacturer hubs, the way we work with them is that they will often refer patients over to the PAN Foundation. So they may transfer or call over. However, we are not able to enroll patients directly with the hub manufacturer. So what that means is if there is a representative from the hub who's trying to apply for assistance on behalf of a patient, they're not able to do that like a provider or pharmacy would be able to do. They would actually need to transfer the patient to us, and then we would work directly with the patient to make sure that they can get enrolled and get the assistance they need. In a similar fashion, we would not provide, claim information or enrollment information to the hub, but we're happy to work directly with the patient and the provider and the pharmacy to make sure that the patient is all set and has no questions.
Perfect. Thank you. That's a very thorough answer and a good question. Aisha, somebody's bringing to our attention that one of the first slides showed payment for premiums. Can you talk a little bit about how that works?
Sure. So right now we have 2 premium assistance programs. What that means, if there is someone who needs help in paying for their health insurance premium, whether it's a commercially insured plan through the exchanges or if it's a Medicare plan, we would be able to supplement that cost. The way that works is that when a patient enrolls in the program, we reach out to their insurance company and we work with that patient to find out the cost of their insurance premium. It's important to note that we only pay an individual's share of the insurance premium, so we may not be able to help with the entire cost, but we definitely would be able to supplement it. The goal of the insurance premium programs is to make sure that people can obtain access to their medications, and so we know that premium costs can be very high and expensive, and so in doing so, we hope that the patients will be able to afford their health insurance and be able to receive their medication in the end.
Thank you so much. And again, another important question and applicable to a lot of people that are listening in today's webinar. The next couple of questions actually look like they're directed towards NeedyMeds. One of them, we have an audience member asking whether or not NeedyMeds covers a specific diagnosis. In this case, it would be cystic fibrosis. So we don't use the terminology that we cover any particular diagnosis or medication because our role here is to connect patients with resources that will help them to save on their healthcare costs. So we're more of a matchmaker. With that being said, however, there are a number of ways on the NeedyMeds website in which you can search for a brand name medication, a generic medication. You can search for assistance geographically, and you can also search for assistance based on a particular diagnosis. And where you would find that is under the Patient Savings tab. You're going to check out the name of your diagnosis. So you would visit again under the Patient Savings tab. You'll look for the Diagnosis-Based Assistance Database, and then look for the name of your diagnosis. One of the things I want to stress is that we never want somebody struggling to find what they need on our website. And certainly, as Aisha said about the PAN Foundation, they encourage you to be vocal about your experience with them. We do the same here at NeedyMeds. We really consider everybody that uses our website our partner. So please be vocal about your experience. And with that being said, in addition to letting us know how it's working out for you, don't ever hesitate to call our expert call center counselors. They're available Monday through Friday, 9 to 5 Eastern Time, and can be reached at that toll-free number on the slide that's on your screen now, which is 1-800-503-6897. I did say that another question was directed towards me, but really it's for both of us. myself and our guest panelists today, we get this question often, which is, what is the relationship between the PAN Foundation and NeedyMeds? And Aisha, I'll go ahead and answer this, and then if you'd like to chime in, that would be wonderful. What I can say is we consider each other partners. And what that means is we, as you can tell, we are very like-minded organizations with missions that clearly align. We believe in providing access to healthcare savings resources to the broadest population that we have access to. And because neither one of us are the magic bullet for anybody's situation, and because we reach and help similar populations, we simply work together as partners, reaching as many people as we possibly can. And we do that by joining together to host webinars, and we do that by being a resource both for each other's organizations. Aisha, does that pretty much sum it up? Is there is anything else you'd like to add?
No, that's a great response. I completely agree. NeedyMeds is a fantastic resource. It's something that we refer to on a daily basis. If we at the call center or any of us on our team here at PAN get a question about a diagnosis that we may not cover. And so, as you said, we are definitely two organizations that work hand in hand with each other.
Exactly. And like I said, I mean, we both organizations, we do the best we can, and we have both, I would say, grown. Certainly NeedyMeds over the last 2 decades. We're celebrating our 20th anniversary. And we started 2 decades ago with a couple of dozen prescription assistance programs, and it's now grown into more than 20,000 points of cost savings. And we are proud of that. But we do stress that we're not the solution for everybody's healthcare problems, which are unfortunately, growing in our country. We can't do this alone. So having like-minded organizations to reach the broadest population and make sure we're fulfilling those needs is absolutely essential. I have another question coming in from somebody looking for specific assistance for diabetics, as well as for being able to afford the high cost of insulin and oral medications. So again, like I had said, with looking for assistance with specific diagnoses, you're going to start under the Patient Savings tab, under the Diagnosis-Based Assistance Programs. Check out what's available there. We also have specific resources, I believe, for what we refer to as diabetic kits. So again, I would say when it comes to looking for assistance, whether it's for a generic or brand name medication, or whether it's for a diagnosis, start on our website, but certainly don't hesitate to call our expert call center counselors. I don't see any other questions coming in, but if any of the people listening are like me, the questions will pop into your mind as soon as the webinar ends. So if that's the case, don't hesitate to reach out to both the PAN Foundation or NeedyMeds. Please check out our websites, call our 800 numbers, shoot us an email to let us know what you think, or certainly if you have any questions. We're hoping to have Aisha come back at a later time for another webinar, but today's, I think we're going to go ahead and wrap up. So Aisha, thank you so much for sharing your expertise with us, and thanks everybody for taking time out of your busy day to learn a little bit more about this important research, the PAN Foundation. Thanks everyone. Have a great afternoon.